Just kind of open it. So light's gonna pass through, hit the cornea. Once it gets the cornea, imagine that you have like a camera lens. A camera, as you twist it, you can kind of make the aperture larger or smaller. That's what our iris is doing. The iris is the colored part of your eye. If you look really close on someone, you can see it's kind of striated. It's actually a muscle. It kind of opens up like one of those Chinese fans. And so that's this blue kind of striated part. That's your iris. And now your pupil is not actually a structure, but it's essentially nothingness. So when you see that like that black dot, it's actually the light coming in and not able to get back out. And so for us, looking at your eyes, I see a black dot, I see a black dot, I see a black dot. Whereas if you have like a red eye effect, that's because your camera is flashing your retina, and what you're seeing is the back of your sclera on that, showing up on the lens. But normally, because light's not coming off your eye, we just see a black dot. So your pupil will be that black dot right in the center. So the structures we named so far, we have the cornea, your iris, and pupil. Next structure is going to be your lens. Now this is where it gets kind of interesting. So your lens is almost kind of malleable. And so like I said, the iris is able to change how much light or how little light gets through your eye by either dilating or constricting your pupils. But we have to be able to focus on things. We're not constantly looking at things that are set 5 feet away. We can look at the moon, which is, for our intents and purposes, infinity, or something really up close and focus on both of them clearly. So that means we have to be able to change the shape of our lens. And I brought these as kind of an example. So these are contact lenses, and they act just like our lens. So here's our contact lens. Now we have muscles called ciliary bodies. So the iris is the muscle on the outside that will control how much light or how little light gets in, by controlling the size of our pupil. And on the inside we have ciliary bodies, which are actually going to control the shape of our lens. So imagine my 2 fingers are ciliary bodies. They'll actually stretch or bring together our lens to change how focused the light will be and where it hits on our retina. So our lens is actually kind of like this kind of malleable, rubbery kind of structure. It's not just a solid piece of glass. Because if it was a solid piece of glass in the back of our eye, we'd only be able to focus on things at a set distance. Any questions so far?
This would be the lens. It's right there. The choroid is the round part. So the brown part, and then the square.
So what's light going to hit next? So first off, even to get here, we have to pass through two liquids. The first liquid, think anterior. Anterior is the aqueous humor. If you know anterior aqueous, you can figure out the rest. So the aqueous humor will fill in this space between your cornea and your iris.
So it's like aqueous humor and vitreous humor. Aqueous humor is on the front, and then this whole thing contains. They call it vitreous body.
Now, so the iris, that colored part of your eye, and your first lens or your cornea. So that's going to be aqueous humor. Now beyond that, more posterior into the eye, you'll have the vitreous humor. So imagine this sphere is full of liquid. That liquid will be the vitreous humor. So that makes up the bulk of our fluid in our eyes, vitreous humor.
This is the right eye. This is superior rectus, right eye. And the oblique side of here, kind of, but they start.
Is the vitreous body the same thing?
Vitreous body? It's something like a thing that kind of contains it all, yeah. Now, you have different layers of our eye. So the functional layer, the layer that's going to be collecting light, is our retina. So the retina is going to be most on the interior. It'll be this almost salmon-colored layer. So as light passes through our cornea, then through our second lens, it's both focused onto a solid beam that hits somewhere on the retina, and our optic nerve, this yellow portion right here, is able to sense that focused light on our photoreceptors, both our cones and rods, and tell us, what are we seeing? Am I seeing a chair? Am I seeing a person? It helps to differentiate those by having a clear image projected onto our retina. So the retina, this salmon area, will be our functional zone. Beyond that, we have our choroid. So it's really, really fine, but you can see salmon color will be retina. This red layer is kind of sandwiched in between will be your choroid. Yep, exactly. And beyond that, on the outside, we have our sclera, which is our connective tissue to our eyeball. So your sclera on your eye is actually the white part. Actually, I take that back. It's not. It'll be inside the actual eyeball. This brown part will be connective tissue, and that'll make up your sclera. So kind of going outside in, sclera is first. That's going to be the first layer that you're hitting. In the middle, you have
Choroid.
yeah, choroid, and in the functional zone,
Retina.
retina. Sweet. Any questions on that so far? Did you guys like this lens like example?
Yeah, it's cool.
Better be worth it because my roommate's not gonna be able to see for a day.
I was wondering.
So occipital, it's not a muscle body.
So muscles of the eye. You got to figure out first off, are we looking at the right eye or the left eye? So looking at the front of the eye, if you see this kind of offshoot, so we're looking at the front. If you see this going to the right, it's the right eye. So it'll be situated like that. So if you're looking at the eye, and this piece, which we'll learn that name soon, is going to the right, it's going to be the right eye. So be sure, if you look at it like that, you're like, oh, that's counter, it's going to the left. It's going to be the right eye because we're worried about the anterior view. Now, do you remember in our leg, we had some muscles. We had
The rectus.
rectus femoris, and then we had three vastus. We had vastus medialis, intermedialis, and lateralis. Here we have actually four rectus. We have a superior, inferior, and a medial and lateral rectus. So it's going to be these kind of square-looking ones, as such. So superior is obviously going to be this one on top. And when this pulls, it's to look up. Inferior rectus, when that contracts, it'll pull our eye down. And medial will be to look inside. Lateral will be to look that way. So if this is the right eye, lateral's on the outside, medial's on the inside, superior, inferior. Now that kind of get back to that weird structure we're talking about. These are called obliques. We'll learn about this once we get to the next unit. But your obliques are going to be like your side muscles. So think side. Because this muscle seems to be coming in from the side, and it's on top, it's a superior muscle coming in from the side. So we'll call this muscle superior oblique. So that white part jutting out, this is the superior oblique. So, as the convention says, if there's a superior, there's an inferior. If there's a greater, there's a lesser. So the inferior oblique will be that muscle right there. Not to be confused with the inferior rectus. This is kind of, if you kind of continue that, it's very much on the side of the eye, coming in from a side angle, whereas this is also coming in from a side angle. It's not straight on any 12 o'clock, 3, 6, and 9. It's kind of at an odd spot. Alright, I know I'm kind of fast. Any questions on that so far? Okay.
So this whole thing is the superior oblique.
Yeah, because it's coming from the side, so it's oblique, and it's on top, superior. And then where's the inferior oblique? Exactly. And that means that this one at the bottom has to be the... Yes, exactly. Inferior rectus. Cool. That's about it.